Hello, my dear friends. Welcome to Aspire 32. And today's topic is again interesting because we generally cover United States, New Zealand, Australia. But I think this is somewhat special because today I have Dr. Geeta with me, and she's practicing dentistry in China, and she's an Indian. Welcome to Aspire 32, Dr. Geeta. It's so good to have you on my channel.
Thank you, sir. It's a pleasure to be on your channel.
So let me briefly introduce my audience. Dr. Geeta here, she finished in 2005. She did BDS from SB Patil Bidar Institute, Karnataka, and then she also worked in Chhattisgarh. Then she finished her post graduation in 2014 in periodontics, that is in Gulbarga. Since 2017, she is working in the China, Jinan provenance, and she is she is working in an international dental clinic since then. Right now, she is in Beijing,
Yes.
and I'm so excited to listen to your journey, and I'm sure this will be really inspiring. How did this thought came that you will end up, or what led to your shift to China from India?
Yes, sir. It is actually this way because I got married after my BDS. So that's how I was started working in Raigad, Chhattisgarh. Because my husband has a posting there because he's a mechanical engineer. So he works for a Zindal Steel and Power Limited. And I worked there for 2 years. And then during that duration, during my work, I somehow got to also plan to study for MDS. And I got through and I got the seat for MDS. And then I moved to Gulbarga. So during this period, I think my husband was thinking to also shift, not shift exactly, from the same company, they send him on site to China. So that's how he came to China first. And then I finished my MDS. And I was very lucky enough that I had 2 years of experience before MDS itself. So then I moved to China and I got the job because I had some experience of my work. So that's how I came to China. And yes, it was initially a bit challenging because I didn't know that I had to learn Mandarin, that's Chinese language. So it was a bit difficult to understand because where I worked before, as you mentioned, Jinan, Shandong province, it is kind of a small city. It's not a big city. Like if you compare in Karnataka, like Gulbarga is a small and Bangalore is quite big. So I was initially came to like Gulbarga, the small city, because my husband was sighted there. So, but still somehow I could get some job there. And that was
So that means what and when you told me that you are practicing in China, first thought it came in mind is how is she able to find the information? Because I can understand that we get information from US. It is easier to find the information, but I can only imagine how difficult it would be. But I really appreciate the steps taken by you, and I'm sure that your husband was very supportive. Because doing post graduation in India and suddenly shifting to a country where that is what I want to know, whether your degrees are recognized. But in general, when you go to foreign country, it's always like they are not recognized. You have a lot of rules and regulation, and that is why I wanted to do this podcast. So you said after your marriage you wanted to shift, and when your husband told you that yeah, now we'll be going to China, and no matter which is the place. What was the first step, and how did you find that information? Like, what is the rules and regulation for an international dentist?
Yes, this is actually very good and interesting question. To be frank, it's really very limited information if you see anywhere in Google, because from China there is very less information you get it. What my first step, in fact, it was not me, it was taken by my husband. He went to an international clinic because it was near to his office, and then he searched how my wife could take a step, because we cannot see something online, there is no information online. And then that particular clinic, they gave reference, like they don't have the authority to tell. So usually they don't decide. So they gave a reference of the head of the department, head of the institute person, and that doctor was very helpful, and he took a Zoom kind of a video conference with me. He wanted to know what skills I am in and what was my experience, so that he could understand. And he helped me, and he told me, okay, you could send me your CV along with the passport, and then all the degree certificates should be authentic. How to say, it's not exactly like for US and for Canada, they do proper processing, but it's in China it's not like that. It has to go through MOE plus China Authentication Center. So that's how I got to know the steps.
Okay, I think it must be very difficult, because I can understand, because so much of restriction is there in China.
Yes.
So you mentioned that you went to an international clinic. What exactly is that international clinic?
So actually, it was a proper polyclinic, you could say, sir. It was only dental clinic. It was like 10 dental chair international clinic. So because that was a clinic which they could accept foreign patients, because here all the clinics don't have license of accepting foreign patients. So only clinics which are accepting foreign patients, they are only authorized to have a foreign dentist.
Okay. So then you are lucky to find some more information. So can you tell me, is it must that you need to have a, like, suppose if I'm not married and I want to shift to China. So you went,
Yes,
you
sir.
had a reason, that is why you went there. Suppose you are a fresh dentist with post graduation or undergraduation. If you directly plan to move to China, is it possible?
I think so, yes. If you learn Chinese, it is definitely yes. That's an added advantage, and your chance of getting a job will be much higher. And you could directly. I think it's better to come to China and put a resume, go personally. Then you, it's very easy to get the job if you know the Chinese language.
Okay. And will the degree will be recognized directly, or do you have to appear for some interview, or you have to
Sir,
appear for some written exam?
it's not no written exam, if I'm not wrong, because I came by post graduation. So for me, they only took a practical kind of two exams they took for me, not exam, just to pass the medical license, because we need to have a medical license to practice here. So it was a 1 day complete interview, where in first half they involved me in having all kind of cases, starting from cleaning, starting from filling everything. So they checked all my skills. And the second part, they gave me a module and X-ray, just like case history and case presentation. And then they made a proper document and they sent it to the Chinese authority to get my medical license to practice here.
Okay. So that is almost 2 days. And how much fees generally they charge for this licensure exam?
So for this license exam, it's very minimal. It's like 500 RMB. You could say 500 RMB is nothing but around 5,500 rupees INR.
And how much time do they take to give the result?
For medical license, yes, it takes a lot of time, because they take all your documents. To get the documents, everything. For me, they took 9 months.
Oh, to get the certification, it takes 9 months.
Yes,
Okay.
sir.
And
Yes.
is it all online, or you will have to submit it offline?
Sir, it is actually the person, the employer who is employing it, they will do it by themselves. So first you need to find a job, and then they help you in the process.
Okay. So this certification has to be done before the job, or once you get the job? The
Sir, first,
practical exam. The practical exam. Do you have to do it
Mhm.
before applying job or after application of job, after getting the job?
So this is actually interesting because every province is different. The first province where I worked, they gave me the license after I finished the practical exam because they wanted to see my skills.
Work. Yes.
There are some areas, there are some province. I'm not sure, but I heard. I'm not sure. So they could give it after your certification. I mean, they once you get authentized or kind of processing time, they could directly give you license.
Okay.
Yes.
So you have finished almost now since 2017 you are working. And
Yes, sir.
now it is 2023, so it's almost 6 years now. How
Yes.
was the journey of dentistry? Do you feel anything different when it comes to dentistry in China compared to India?
Yes, there is a lot of difference, definitely, because of acceptance. Maybe in India, we get to see cases which is actually very much required. Maybe we don't have that much focused dental hygiene rules. Whereas here in China, where I'm working, it's mainly international based. So I see clients from most of the countries. I see like 1% of Chinese clients and 99% of foreign clients. So uh, there's difference. Yes, there is difference.
Okay. And
Yes.
if suppose you have a postgraduate degree, will you be able to practice specialty dentistry or you have to practice the general dentistry?
No, you could practice your postgraduate specialized degree here without any problem. So I do flap surgeries, I place implants, so no problem.
But how is the practice of implants in your place?
I think yes, it is, and also more than implant, I could divide into pedo, ortho, and implant. Three bands together, like equally.
So it is
Here,
you are
pedo cases.
practicing more of a comprehensive. There is a comprehensive approach to each case rather than you are focusing on only one aspect.
Yes, sir. Yes, exactly. So I do pedo under general anesthesia with the help of our hospital anesthetist department. So that's really very interesting for me. I learned here. So and I do flap. That's solely me because I'm the only periodontist here. And implantologist, we have surgeons, so we together do.
So the team what you have at the place where
Yes,
you
sir.
are working, do you have a lot of international dentists?
At the moment, I'm the only international dentist here at Raffles. Uh, Previously, we had my colleague, one was from German and one from Australia and another from France. So at the moment, the France dentist, he's still there.
And how does your day start? I'm very much interested because we have so different lifestyle in India. There's so much of
Yes.
family, and I'm sure I don't know how often you visit India. How often do you visit India?
Sir, to be frank, because of all this COVID, you know how it was the situation. So it's been 3.5 years I haven't visited. So I'll be visiting next week. So I'm very excited for that. And now
Acha.
that I have a baby and the baby was born here, so it's more special for me.
Okay,
Yes.
congratulations.
Thank
I'm
you,
sure
sir.
it's a wonderful phase. It's a new milestone. So,
Yes, sir.
of course, I know the transport, everything is advanced in China because some of my colleagues have visited there and they are quite impressed with
Yes,
the
yes,
infrastructure. So,
yes.
how does your day start? How does it go?
Sir, if I have to divide my work lifestyle and personal lifestyle, it's really very interesting. Work lifestyle starts from 9 o'clock, 9 to 1, and 1 to 2 have a lunch, and 2 to 5. And after 5, nobody disturbs you. Let it be
Okay.
anything. Yeah,
Hmm.
it's really pretty much fixed and it's pretty much very smooth.
Well
And
balanced.
also your patients are well booked before ahead because it's an online system. So
Hmm.
you know your schedule 1 week before that how many
Okay.
patients you have.
Do you have a good dental assistant support there?
Yes, sir. Very good. Very good. Most of my colleagues, my assistants are had experience in Saudi, Dubai, so they are Chinese. But yes, very good.
So you
Mm.
finish, and how does the evening go? What are your personal hobbies? How do you spend time? Of course, I know with baby it's very difficult, but before this,
Yeah.
I'm sure what else do you do? How is the work life balance? What else do you do in China?
Sir, there are many things to do actually here. You are so exposed to many things because the garden, the space, as I said, the technology. They use each and every technology here. For example, if it's a big garden, they have put these physical exercise instruments there. It's free of cost. You could go and do, and there are a bunch of classes, dance classes going around. You could go and join the classes, which is very happening every evening, every day.
Okay.
And not only that, yes, and most of the malls or most of the streets, they are full with the light, solar light, and every day there's some other show. If you just pass around the road, you just pass around the park, it's just really very nice. You feel that you don't want to go back home.
Very nice to hear.
Yes.
And do you find Indians in your circle? Do you really have Indians there?
Yes, yes. Beijing has a lot of Indians because of IT and pharma. IT and pharma is boom here, and Indian embassy is also here. So I have a lot of. I mean, most of Indian embassy knows that okay, there is one Indian dentist available at Raffles Hospital because our hospital is associated with almost all the embassies situated in Beijing.
So work-life balance is amazing. You work whole 6 days, 6 days in a week, or is like weekend is off there?
I have to work only 166 hours a month. You choose whatever time you want to work. It's no hard and fast rule. So I could work Monday to Friday and take Saturday, Sunday off. So sometimes I work Saturday and Sunday because my husband has to go to office. Because of baby, we are shifting our schedule. Because getting a servant here is very expensive. Another whole different story here.
I think that is true for any country, like except India. For
Yes,
domestic
sir.
help is the most important challenge in foreign countries is the domestic help, right?
True,
So I
sir.
think that
True.
is where the India has a positive side. So how do
Yes,
you how
yes.
do you upgrade yourself with knowledge? Do you have CMEs? Are you able to do any advanced additional course?
Sir, this is a bit challenging because here, if I have to attend any CME or any courses, they are mostly in Chinese, which I cannot understand because my Chinese is very basic, not like senior level Chinese. So I never attended anything in past. I just see online. So, but this time coming to India, so I have planned few to attend some courses. And here at Raffles Hospital, we do have CME every Tuesday. Every doctor, every one of each one of us discuss about the cases and they tell about their department specialty. So yeah, in that way, it's good.
Okay. So
Yes.
it looks like the language is something which is very important. You may be highly skilled, but the language is something which you must learn. How easy was it to because we see sometimes we hear the clips, it's very difficult. How were you able to manage it? Did you take any classes?
Yes, sir. Initially, for me, if I have to tell, I started to cry because I didn't understand anything. And I was cursing my husband that why we landed here in China, why
I
not some other
understand.
country?
Yes.
So, yeah, but slowly, one good thing was people really try to understand here and they try to help you, even if you start speaking one single word of it. So, that was a very motivating point for me. And there were some classes I took here. The teacher used to come home. I paid for the classes, so that helped me a lot.
Okay. So you are able to now manage pretty much the basic language. So basic
Yes, sir.
information. And how do you become
Yes.
expert in that? By do you have
Well,
special classes for being expert? or it will come with practice?
No, I think it will definitely come with practice. Before where I was, that place I used to use much more oftenly. So I was in fact getting progressive every day. But after coming to Beijing, I think I'm not progressing in the language because here most of us speak English. And as I said in the beginning, that here I'm only seeing international clients. So it became like I have become zero after coming to Beijing.
I'm not sure whether I should ask this question, but do you think it is financially more there are more benefits in at your place than compared to India? How is it? How do you think is the like? I don't want specific answer, but you must be hearing, talking to your friends, and you might get an idea. Like for example, we know in US dentists are highly paid. How is the scenario in China? Is it like India where people do say there is definite initial struggle? Do you hear similar information in China too?
It is pretty much same, I could say. But yes, I know both answers because I say yes. As I said, where I was working previously, that was a completely different city. So the pay was very much different. And now where I am right now, it's completely different here. So if you know language and if you have skills, definitely you could earn a lot.
Okay.
And as I mentioned, pedo, ortho, and implant, these three branches have a lot of scope.
So if I ask you four important things which you have learned in China over 7 years, because we often
Yes,
hear it's quite different country. So what do
country.
you
Yeah.
think there are best four things for Indians or a foreigner in China?
Yes, sir. So first important point after coming to China, what I really like is the time. They give a lot of preference to the time, and here the ethical rules, the labor law is very very important, and they strictly follow it. So that's what I really liked. Friendly nature that is there even in India and here. And one more important point, I never ever felt that they treat me as an outsider. They accepted me, so that was really really a welcoming point for me to stay in China.
Very nice. And can you tell me around three things which you miss from India, which you don't see there?
I miss food definitely, and my
Okay.
country's soil and smell definitely, and my
Mhm.
mom, my parents, family. Only thing is, I could say if someone wants to come here and want to work, I would say them first try to look for the province. Province is nothing but the state. Which province you would like to come? Because every province has their own specialty and every province has their own pay scale. So it's very different. Like I'm in Beijing, but the expenses are quite high. If you Google, the first place comes in expenses is Beijing. Cost of living is very very high. So if you
Mhm.
choose a place or province, and if you get into one of the dental clinic, then that's perfect. Then your processing the certification medical license will be super easy. You don't have to worry, you don't have to, they themselves help you everything.
So expenses very high at your place. If you can just give a rough idea, like in Indian currency, like one day or 1 month for a single person, how much may be the expense?
So for one person minimum 50,000 you have to give for the housing, and another 30,000 for overall food. So
So
yeah.
almost a lakh, 1 lakh rupees of expenses per person per
Per
month.
person.
Per
Yes
month.
sir, yes, yes, yes.
Okay. And where does the salary for dentists generally range? If you have a very broad range from this, do you have any idea?
Sir, it is like how to say, it's kind of a freelancing. If you have,
Okay.
it's commission based here. And
Understood.
if you're doing, you could, you have no limits, you could do
Okay.
how much ever you could. Yes sir, yes, yes.
So it was quite interesting, Dr. Geeta, to listen to you, and I know this topic is very rare, and
Yes.
I have. It's more about listening to your experiences because you told me that the process is very simple, but it is actually the language, the place for which you have to get used to. I want to once again thank you,
Exactly.
Dr. Geeta, for giving me your time, and it was an excellent webinar, and happy to hear from you.
Thank you, sir. Thank you. I'll be very happy to answer any questions regarding the job opportunity or regarding how to process. I'm always here. Thank you so much, sir, for having me here.